Hello, welcome to another episode of Matters of the Heart. This program is brought to you by Haverhill Community Television and Pentucket Medical. My name is Dr. Purati. I'm a cardiologist at Pentucket Medical Associates. I'm here with my associate, Dr. Seth Bilazarian. He's going to talk to you about aging and diseases of the heart.
Great. Well, thank you, Dr. Purati, for that introduction. And tonight I want to talk about something that really is something we almost talk about at every one of our episodes of Matters of the Heart. It really has to do with aging and aging's impact on different diseases. At other episodes, we've talked about different problems, heart rhythm problems, congestive heart failure, atrial fibrillation. Many of these have a really important component of aging on when they show up in our lives and how they become more severe as we become more aged. And today I want to really focus on aging itself and how it affects certain different heart problems, and want to talk with you and get your insights about some of these different areas as well that you and I both take care of with our patients. Briefly, I would say that aging is something that we all recognize, and the aging process affects different body systems, and it results in alterations in how these different organ systems, our heart, our liver, our kidneys, and of course our skin is something that everyone recognizes as something that goes through a process of alteration from the time we're infants through our growth years and then through our adult years, goes through dramatic changes. Some of the simplest things that happen with the alterations we can identify. If you just take a few minutes to touch an infant or a baby's skin, and then touch an older person's skin or a middle-aged person's skin, you can tell there are different properties of the skin, that the skin becomes a little bit more less flexible, a little less responsive, and a little less soft. Those are some of the same types of processes that are happening to our blood vessels, our heart, and our other organs. So these are some of the processes that everyone recognizes. Some of the processes that are changing may go really unnoticed for a number of years. In middle life, these changes are occurring in people's 30s and 40s and 50s. Clearly there are changes, but often these changes aren't recognized. There's nothing really happening that's different. But what we notice often in our practice as cardiologists is that sometimes in later adult life, in 50s, 60s, and 70s, patients ascribe or attribute some changes to their exercise capacity and other kinds of things to aging, when in fact it may be to something that's really more concerning. So one thing I want to talk about today, we'll emphasize it later as well, is that when people have certain symptoms, it's usually not appropriate to just say, well, I'm just getting older. If you're having more difficulty climbing a flight of stairs or having some symptoms, it's generally not a good idea to attribute that to something that's just related to aging. Aging may be playing a role, but usually the aging is playing a role as part of a process of problems with part of the body systems. Normally for us as cardiologists, it's the heart or the blood vessel system. One of the things that happens with aging is this process called atherosclerosis. Atherosclerosis is the process whereby the arteries themselves become thickened, narrowed. They can become laden with a chemical called calcium that can make them like bones. The arteries themselves, instead of becoming very soft and flexible tubes for carrying blood, they can actually become like bony canals. It was written last century. So that's one of the processes that we'll talk about. And with the aging of our population, I think there obviously will be significant impact on how we deal with this as a society, and healthcare policy, I think, will be really important on how we deal with the aging process and how the aging process affects different organ systems. And again, I'm focusing tonight primarily on the heart issues. So we're going to talk about how we can make some impacts on slowing the process, how we can make impact on identifying when aging is doing something more than sort of what would be considered normal aging, to when something can actually become a real problem with impact on our heart and blood vessels. So some of the processes that accompany aging, I'd like to just talk about. There are four impacts that the aging has on our heart, and I will just talk about those briefly. And I mentioned them a little bit earlier when I mentioned something about the issue regarding the way skin feels. One of those processes is a change in the elasticity. All of our tissues have a certain amount of elasticness, sort of like an elastic or rubber band, and that amount of elasticity can be lost as time goes by with aging. that has a real impact, because when our heart is less elastic, less flexible, we can see many different problems that can occur. The heart's stiffness or lack of elasticity can really make it much more difficult for the heart to perform. And half of patients who have congestive heart failure have this problem with a reduced elasticity of the heart. In addition to a loss of elasticity of the heart, in addition, blood vessels themselves can become less elastic. So when our heart pumps and squeezes a certain amount of blood out of it in each heartbeat, that blood is projected in a very forceful way into the main artery of the body called the aorta. And that projected blood in a younger person is received, and the blood vessel wall actually stretches to allow the blood to come into it. An older person has a much stiffer artery that's more like a pipe, so that when the blood is ejected, blood pressure will rise very significantly. And patients who are older often have a very high blood pressure. The top number is very high, and the bottom number of their blood pressure is very low. This problem is called isolated systolic hypertension. And the widened blood pressure, having a very high top number and a very low bottom number, is called the pulse pressure. That widened pulse pressure, we think, is a very significant contributor to the risk of stroke and heart issues. So this elastic problem, this loss of elasticity, this thickening and stiffening of the heart and the blood vessels, is a major contributor to a variety of important issues like heart and disease and stroke. The second problem that I want to mention of these four major problems, first being elasticity, the second is the atherosclerosis process. And we've had many episodes in the past, for those of you who are regular viewers of Matters of the Heart, talking about artery blockages, whether it's artery blockages of the heart, blood vessels of the legs, blood vessels of going to the brain, the carotid arteries. This atherosclerotic process is a very severe problem and results in many of the problems that can ultimately cause problems down the road, like heart attacks and strokes, angina, which is the chest pain of the heart caused by reduced blood flow, or reduced blood flow to the legs, causing a problem called claudication. So atherosclerosis has many significant problems. We can identify the atherosclerotic process best in the carotid arteries, the main arteries that go to our brain. You can feel your own carotid artery pulse by laying your fingers on your neck. You can feel the pulsation of that artery. The carotid artery is very interesting because we actually have the ability to look at it with ultrasound. It's the best artery to look at for atherosclerosis. It's very easy because it's very close to the surface, and this technology is done without any radiation. It's a very low-risk procedure, but we can actually see early thickening of the wall of the artery. If the artery is even minimally thick, 0.7 millimeters, a very small amount, it is said that that amount of thickening identified on a carotid ultrasound predicts a higher risk of heart attacks and other problems. Not because that artery will cause a heart attack. It is just said that because that artery has developed that amount of plaquing, we can then confidently assume that there's plaquing in other arteries, and therefore the patient's at higher risk for heart attack and other problems. So that's the second problem that happens with aging, is the atherosclerosis process. The third problem is an increase in the mass or the weight of the heart. This thickening of the heart muscle often occurs with aging. It is certainly accelerated by a couple of other problems. Patients who are overweight, or patients who have high blood pressure, or patients who have diabetes have a thickening in the wall of the heart, and this thickening of the wall of the heart can cause a variety of problems, making people short of breath, can ultimately cause congestive heart failure or a variety of other problems. It also keeps company with other problems that we've mentioned on this show, like atrial fibrillation or other problems. So this thickening of the heart, or increase in the mass of the heart, and it also results in a thickening of the arteries. So the arteries become thick. So this thickening, or hypertrophy as it's sometimes called, is a third problem that results from aging. And then the fourth problem that can result from aging is something I mentioned as well, is this calcification. We hear that calcium is a very important chemical for bone health, and that's certainly true. We know that women are at higher risk for problems with calcium deficiency in bone health. But calcification, if it's deposited in the walls of the arteries, is a very bad and detrimental thing. So we know that calcification itself causes some of these problems of thickening and loss of elasticity. The artery becomes less like a very soft tube, like a soft plastic or rubber tube that receives blood, and more like a bony canal or an artery that can be problematic. So those are the four main things I'll just mention that are the processes that accompany aging. And just to mention them again is the loss of elasticity, the atherosclerosis, or the narrowing of the arteries, the increase in the mass or thickening of the heart. The heart size becomes big. Some patients know that they may have had a parent or grandparent that were told that they had a big heart. That's something that can sometimes be seen on a chest x-ray. And then the calcification is the fourth thing that we see as a process of aging that can occur over time. So symptoms that lead to that can lead to the importance of us encouraging our audience to think seriously about seeking attention are some problems that Dr. Parati and I see. And Dr. Parati, you want to make mention of some of these problems that you've seen that patients may present with that we should really encourage them to see a physician about?
The most common things: chest pain, shortness of breath, fainting spells, fast heartbeats. That's the most common things I see.
Okay, so all of those things I would agree. So just to repeat what you said, I think I agree with you completely. So chest pain, shortness of breath, I think fatigue can sometimes be something that can be concerning. A fast or irregular heartbeat or even a slow heartbeat, lightheadedness, pain in the legs with walking, chest pressure or chest discomfort or discomfort that occurs in the jaw or throat or shoulder. These are all concerning symptoms, and we would hate to have anyone think, because we're definitely not saying that in this program, that those are normal parts of aging. Those are things that have happened because aging has caused problems with the heart or blood vessels, and those really warrant attention for patients to begin either with their primary care doctor or to see a cardiologist. So those are things that we think that should definitely lead to a medical consultation. So one of the things specifically that Dr. Parati just mentioned is a problem that results from problems with the heart arteries, can result from problems and changes in the heart muscle that I just described. And that problem is sometimes called angina or angina. Doctors sometimes call it angina pectoris. It's the Latin word for pain in the chest, basically. And this pain in the chest sometimes is described as a chest tightness, a heaviness, a squeezing. It can be those characteristics. Sometimes patients feel like there's a tight knot in the center of their chest that can be anywhere in the chest, but often in the center of the chest, but can be in the throat or the jaw. This often is something that may occur with physical exertion. So someone may say to us that they notice it happens when they're climbing a flight of stairs, or they're bringing groceries in, or they're bringing laundry up from the basement, or they notice it when they're walking to try to catch a bus, or when they're on a trip and they're bringing along their luggage in the airport, they get some of this discomfort. And those are all things that we are very concerned about. It's a very frequent symptom in the elderly, and it becomes more frequent with advancing age, but we don't think it's a normal part of aging. It's a function of the heart problems that are related to aging. Sometimes people can have these problems that are not classically chest pain, and these are the patients that really worry us because we know that patients can have hearts that are suffering without typical chest discomfort. All those symptoms I just described, doctors would call typical, but patients can have atypical or not typical pains that may be from the heart but aren't typically related to the heart. And this becomes very difficult. So patients, and often we think this can be more common in elderly patients, and we think sometimes more common in women patients who have symptoms that may be related more to fatigue or shortness of breath, or may have no symptoms at all, because we often have patients who actually have a heart attack that's completely silent. And both Dr. Parati and I have taken care of patients who have actually had a heart attack. We see evidence of it on their EKG or on their stress test. There's no doubt they've had a heart attack, but they never knew they had a heart attack. So that's a suggestion of someone who's not only had angina, pain-related, but actually had a full-blown heart attack without knowing it because their pain was silent. So ultimately, the testing for this kind of angina we've talked about in other matters of the heart episodes, but usually doctors will do an EKG, sometimes a stress test with or without some kinds of imaging, like a nuclear stress test or an echocardiogram stress test, and ultimately that may lead to a catheterization or an angiogram to absolutely evaluate the artery blockage status. But we know, and this is something that's important, and I hear this often, and I'm sure that my colleague Dr. Parati hears this as well, patients will say, well, aren't I too old for the kinds of treatments related to these kinds of problems? And it's really remarkable that all of the treatments that we have found to be very effective for younger patients, like medical treatment, angioplasty with stents and balloons, and even bypass surgery, are very effective through the 80s, and even sometimes in very fit and well 90-year-olds. We've had good success with using these strategies for patients who are older. So we want to really dispel that notion. It's not saying it's right for everybody, but we shouldn't discount it for some patients just because of their age, because many of our patients are excellent and fit and doing well, and we offer these strategies with good success. So continuing on to another problem that sometimes happens with age-related heart issues is a problem called acute coronary syndromes. Acute coronary syndromes is a common term that's used now. You may hear a family member, somebody who's been admitted with an ACS, acute coronary syndrome. This is a situation where someone comes to the hospital and we're worried that they may be having a heart attack. At the end of the hospitalization, we may decide they did or they didn't have a heart attack, but they had a threatened heart attack. We were worried enough that they might be having heart pains related to an artery blockage issue, and this acute coronary syndrome is something that's very important. It's more frequent with people as they get older. We've seen a really wonderful decrease in the death related to this problem over the last several years. Our use of aspirin and a medicine called Plavix, and use of angioplasty and treatments like that, as well as beta blocker medicines, has really dramatically reduced the mortality or the death rate with this problem. But unfortunately, elderly patients are still the main folks who have problems with it. 85% of everybody who dies from acute coronary syndromes are over 65 years old. So is that because these patients have more advanced disease because they're older, or because sometimes they're unwilling to accept more aggressive therapies, or doctors are unwilling to discuss that with them? It's unclear at this time, but the medical profession is trying to address this by being more aware of this, and also trying to bring them this message, as I am today, to our patients, that we shouldn't not proceed, or at least consider proceeding with treatments like this for our older patients. Younger patients often have more characteristic or typical pains, like I described with acute coronary syndromes, more pressure or heaviness types of pains. Our older patients often have less typical, so we don't have the same types of clues. Sometimes patients will just have shortness of breath or feel fatigued or unwell. So for those patients, it can be more difficult to make the diagnosis of a heart-related issue like acute coronary syndromes. But our hope is to become increasingly alert and thoughtful about this, and to seek patients in this way to seek attention for this with their doctors or their cardiologists. But we do know, and again, to say the same thing I said just a minute ago with the angina pectoris issue, that patients who have acute coronary syndromes who are older definitely benefit by the same aggressive strategies. Plavix and aspirin, angioplasty when appropriate, are excellent therapies for these patients even when they're older. So we want to make sure that they know that there's really good evidence that patients in their 80s and even into their 90s have good results often. They may not. There may be other reasons why we shouldn't do it in older patients because of other risk factors, other medical problems. But age alone is not a reason we shouldn't proceed with this for patients. The next thing I would say is talk about an area that Dr. Parati has expertise with is heart failure. Heart failure, or congestive heart failure, or CHF, is a common problem that affects older patients. And this, as Dr. Parati knows, is something that happens when patients have fatigue and shortness of breath. Their legs can be swollen, something called pedal edema. This is a common symptom when the heart fails. And we know that this heart failure problem increases with increasing age. So as our population is getting older, we're seeing more congestive heart failure. And this results from just a problem with the heart doing its job of pumping, either because the heart is weak, and this heart weakness results in inability for the heart to pump, or the heart is stiff. Half of our patients have a problem related to a stiffening of the heart, and half of our patients have it related to a weakness of the power of the heart. And this is a very serious problem, and this is the underlying cause that relates to it. The reason why patients have the weakness from the heart power is usually from either old heart attacks or problems with reduced blood flow from heart artery blockage issues. That's the weakness problem. Also, another cause of weakness of the heart problem is long-term and significant alcohol use. The other cause of half of the hearts are the heart is strong but stiff, so it doesn't have that elasticity I described earlier to accept blood into it each beat. And that's called diastolic dysfunction. And diastolic dysfunction is more common in elderly patients and more common in women. So that's another problem, and this heart failure is something that really needs to be aggressively treated because patients frequently have a lot of hospitalizations with this. They keep going back to the hospital because they fill up with fluid, have difficulty breathing, and it can be a life-threatening problem. So it's something that really requires regular attention. And again, this is something that we see with patients. We hear patients say, oh, well, I was short of breath, but I thought it was just because I was getting older. And I think that's something that may be the case. It may be that the patient is not fit and not exercising, but it may also be related to a problem like this and may require real attention to be evaluated through a primary care doctor or a cardiologist. The next general topic is a topic of irregular heart rhythms that occur with aging. We've talked about irregular heart rhythms in the past on this program, both very fast heart rhythms and very slow heart rhythms. Irregular heart rhythms, a common heart rhythm is atrial fibrillation. Dr. Parati, my associate, is an expert in arrhythmia and the only electrophysiologist in the Merrimack Valley, and I'll ask him to give his thoughts about aging and irregular and fast heartbeats, as well as slow heartbeats.
Okay. As you get older, both fast heartbeats and slow heartbeats become more common. The most common fast heartbeat is atrial fibrillation, as you mentioned. It becomes more and more prevalent as people get older and older. It's the most common arrhythmia. There are other causes of fast heartbeats in the elderly. We won't go into them. That's for people who are really sick and have had major heart attacks. They have different kinds of fast heartbeats. And as far as slow heartbeats, as you get older, especially into the 80s and the 90s, the conduction system gets little sluggish, and the pacemaker of the heart it becomes less reliable, and that's the common cause of fainting spells in the elderly. Because the pacemaker is not reliable, it misses a beat, it misses a few beats in a row, and people faint. And oftentimes when the doctor tests the heart, they find that it's too slow. So too slow, too fast, they're both common in the elderly.
Okay, great. So again, part of that whole aging process of, as you said, the aging process results in the electrical system becoming sort of like an old electrical system in a house, becomes sort of worn out a little bit, and patients may have slow heartbeats or fast heartbeats for a variety of electrical problems. So again, a function of the aging process that may result from aging, but is not something that we would just say, oh, it's just aging. We have a variety of good techniques for treatment of that. The slow heartbeats, of course, would be implantation of a pacemaker, which is something that you do very well. And treatments of fast heartbeats would be often with medications or other kinds of treatments. So what can we do for prevention? So, aging is something that we can't prevent. We can certainly not stop the clock, stop the aging process. But we will say that most of the advice that we give to younger patients is absolutely relevant and appropriate for older patients. Advice like keeping fit, exercising regularly, taking blood pressure and cholesterol medicines are all strategies that absolutely work for older patients. Cholesterol medicines like the statin-type medicines, even in patients over 80, have been shown to reduce the risk of strokes and death. So there's some controversy. Some patients believe that they shouldn't be on it if they're older, and that is absolutely not correct. If someone has a high cholesterol, we really think that that's an appropriate treatment for patients, even if they're older patients, to try to slow the effects of aging and these other problems like cholesterol and blood pressure. So all of those things, yes.
Okay, I have a question for you.
Sure, go ahead.
You said the 4 things that are more common as people get older. One of them was elasticity.
Yes.
Gets reduced, and the other one is the cholesterol on the wall.
The calcium, yes.
The calcium on the wall.
Yes.
The other one was atherosclerosis.
Yes.
Okay, so which one is?
And then the fourth one was the mass of the heart and thickening of the vessels.
So the cholesterol medicine does what?
The cholesterol medicine results in some of the processes of aging and the thickening of the heart and whatnot result from deposit of cholesterol in the wall of the artery. So if we don't deposit cholesterol in the wall of the artery, it may not contribute to the thickening of the heart. And the calcium is also thought to be part of the cholesterol process. When cholesterol is in the wall of the artery, the body tries to get rid of it, and it tries to get rid of it and then fails, and then calcium deposits in its place.
Okay, so the cholesterol medicine prevents the atherosclerosis
Yes.
and the calcium.
Yes.
Now, some
Or reduces it. I'm not sure we could say prevents it.
Oh, okay. And so the question sometimes comes from patients is, should they stop their calcium pills?
Well, it's a really good question, and we actually covered that in another Matters of the Heart, but I will say that there's a fair amount of controversy about whether calcium is the right medicine for patients who have even problems with low bone density. And the question is that there's some evidence that when we take calcium, our blood pressure goes up, and the calcium levels in our bloodstream goes up, and that may make it easier to deposit in the wall of the artery. And some people are wondering whether it's better to treat deficiencies in calcium with vitamin D. It might be a better way to reduce risk for bone problems and be safer for our arteries and reduce the rise in the blood pressure that happens when we take calcium. So I would say at least patients should be asking their doctors about checking their vitamin D level. If it's low, that should definitely be treated. Whether there are going to be changes in our guidelines in the future about calcium are a good question, but I think it's a good one. So we'll just quickly run through in the last minute the summary slides that we have there at the end. The alterations induced by advanced aging are alterations in the arteries, the decreased elasticity, decreased compliance, there's less able to accept blood into the heart size. The heart size gets bigger, but the area for the blood to go in becomes smaller. It sort of sounds complex, but it's like having a bigger car with less headroom and footroom. That's sort of the way I would put it. Atherosclerosis is that narrowing that Dr. Parati just talked about. There are other alterations in the heart like fibrosis or deposit of non-functioning tissue in the heart, increase in mass and calcification. And all of these consequences can then result in increased blood pressure, angina, or the pressure in the heart attack, and heart failure. So again, the final summary I would say is that there are a variety of things that we can't prevent with aging, but there are some things that we can slow that are happening with aging, like the blood pressure effects on the artery in the heart, the cholesterol effects on the artery in the heart, our body's weight effects on artery and heart, and all of these things, if we work together, can slow the consequences down the road. And we would strongly urge that patients almost never, at least first, say, it must be I'm just getting older when they have symptoms. Really, they should seek attention with another doctor. So thank you, Dr. Parati, for joining me. I will sign off. This is Dr. Seth Bilazarian and Dr. Isaac Parati signing off for another episode of Matters of the Heart. This episode brought to you again by Haverhill Community Television and Pentucket Medical Cardiology. And we will, in the future, look forward to hearing from you on a new email that we're going to be presenting on each of our website for future questions and concerns. The email will be brought to you on our next episode. Thank you and good night.